Danielle's story.
I remember that I wanted to be a nurse from when I was a little kid. I remember like my Fisher-Price doctor's kit. That was like my favorite toy as a kid. I loved that. So when I entered into college, I decided to pursue a career in nursing to kind of get myself into the medical field to see if this was really the thing for me and this is what I wanted to do. And sure enough, I fell in love with it and I've been in love with it ever since. And now I'm working as a nurse up at Beverly Hospital in Beverly, Massachusetts. I was born missing the lower half of my right arm. When I was just about a year old, I got my first prosthesis. It was like a hook prosthesis. And then when I was in first grade, I got a hand like this. It's one of the first hands I ever had. And this was actually, this is just the glove of what it looks like, but it was a myoelectric prosthesis, which means that it would have the capacity that when I pressed certain electrodes that were within this socket here of this glove, it would open and close like so. And I had that up until I was probably 16 or 17. And then I wasn't using it that much, and it was really heavy, and I just found I could do things so much easier without a prosthesis in general, partly because this is the way I was born, and having adapted so well. I started out as a freshman and had my first 2 years. They were great. I met a ton of people. It was a great transition. I mean, everyone always knew that was just the way I was, and no one ever treated me any differently for it, and I never had a problem. People just accepted me. At the beginning of my junior year, that's when I entered the nursing program, and I started to actually pursue my dream. And then my first week, it became apparent to the nursing program that I had one hand, and they were just shocked and totally appalled that I hadn't disclosed this thus far. And I was approached about my disability in the hallway in school. The dean of nursing actually approached me, and she kind of berated me in front of faculty and other students and asked me how I expected to be a nurse with one hand. One professor in particular and the dean of nursing, they had the biggest problem with me trying to be in this, and they never once saw me in a clinical setting performing, nursing care on patients. I remember them telling me that they felt like bulls in a china closet around me, that they didn't know how to talk to me, and they were shocked that I'd never had to deal with something like this before in my life. So then there became a long period where I had to get notes from doctors, and I had to speak to the disability department at school, approving my abilities to stay in the program, and I had to sit down with the nursing department, and they basically said that I would be kind of like on extra watch, where they would watch my every move and make sure that I was performing, quote unquote, up to par or up to their standards.
When Danielle called to tell me what was happening at her college, I was extremely upset because, first of all, she'd worked for us and we could see what she could do. She's amazing doing blood pressures, anything you asked her to do. So I said I'd be happy to talk to the school and tell them how she had functioned here and had been working for us, and what accomplishments she had done.
Candy was also a great ally for me. I actually called her and spoke to her on the phone and just asked her, was I outstretching my limits? Was this something that I was capable of? And she, got really fired up, and she was never once doubted it. She said, you keep pursuing them. She volunteered her time to talk to them. She actually spoke one-on-one to the dean of nursing, and she kind of was like my biggest fan, always cheering me on to keep in it, keep supporting me.
The director of the program for nursing there called me. It was not a conversation that went well. In fact, to the point that I said, do you even have knowledge of the American Disabilities Act? Because I was so horrified that they would not accommodate and do everything they could to help her succeed.
It wasn't until my second semester of my junior year when 2 skills sets came up and I was having trouble doing it. My school said that the only way that I would be allowed to continue in the nursing program was as if I was able to complete these skills, and I had to be able to perform them competently. They would offer no assistance. All that they would buy me was time, and that time would be allowing me this summer to be able to finish these skills and master them and then come back in the fall and be tested on them. And if I was able to pass, I could continue into my senior year. If I did not pass, I would have to leave the nursing program.
So that summer she came in and she had her list of tasks, and that summer she was what we call a student extern, and those are senior year nursing students, and students entering their senior year, and we give them a position where they work one-on-one with one RN for the summer, functioning as an RN with the exception of giving medications.
It was a very tough summer. It was very hard just knowing that I'd come this far and might have to give up my dream, but at the same time it ignited such a spark and such a fire in me to kind of get this done and to say, okay, you know what, this is your opportunity. You've been given this amount of time. There was a great man who developed my first myoelectric prosthesis that I talked about earlier, and he developed the arm that would open and close automatically. He's a gadgetologist too. His name is Wally Williams. So we kind of developed a device that I later went and modified with an occupational therapist. And this device kind of fit into the suctioning tube and allowed me to perform suctioning with one hand. And at the end of the summer, I went and met with one of the nursing professors, and she gave me the lab test over again, and I had to perform the skills. And after that, she approved my skills, and I was able to pass. My senior year, the last semester, I sailed through without a problem, and I remember just on my last day of classes, just getting out of class and just for the first time breathing just like a sign of relief, like I had made it, I'd gotten through, and I was going to be a nurse, and it was just such an awesome feeling. Can you put this on a finger for me? You can pick any finger. There you go.
After that, she did apply for an RN position early on here, and there was no question that she was hired. The patients are amazed by Danielle. They'll send back letters. Certain patients send back thank you cards or letters, and they'll say, the little girl with one arm. I love the little girl with one arm, but she gets back more letters than any other nurse of mine. Last year, this hospital started a new award called a Service Standards Award. Nominations went from all over the hospital system, and Danielle received it for the Beverly site because of so many letters and cards.
I'm going to check your oxygen level, okay? I didn't disclose my disability when I first went to college because I didn't anticipate it to be a problem, but not only that, was just based on the fact that I had never had a problem with my disability. I never needed accommodations. I didn't need accommodations from the campus. Whatever I would need to do on a daily basis, I was able to function as every other student. Take a deep breath for a minute. Taking a step back and looking at this whole experience, if I could have done anything different from now on, I probably would have maybe disclosed that I had a disability from the beginning to see what kind of accommodations would be out there and available, especially from the university, and to see if they would be willing to support me. If your university is willing to support you, it makes such a difference in the world. I feel that my disability is a gift to me because it allows me the challenge to do things a little bit differently from everybody else. And I feel that I've been given this gift and I've been able to pursue my dream and accomplish my goals. And my kind of role now is to be a role model to educate others that they too have gifts, their disabilities are gifts, and that they can use their gifts to go where they need to and to pursue their dreams and to challenge themselves to kind of do things in a different perspective or a different light.
For more information on your rights and obligations under the Americans with Disabilities Act, call us at 1-800-949-4232, voice or TTY, or visit us on the web at www.newenglandada.org. Produced by No Limits Media Incorporated for the New England ADA Center, Disabilities in Business Technical Assistance Center. Oshie Harrison, EDD Project Director. Produced under a grant from the National Institute of Disability Rehabilitation and Research, a project of Adaptive Environments Institute for Human-Centered Design.